Susan and Russell, thank you so very much. That was really a wonderful talk and some great questions. Our next speaker is Kate Jansen. Kate is going to be speaking about their research around BDSM practitioner perceptions of discrimination and inequity with healthcare services. Kate, take it away.
So I am really excited to be presenting some of the research that I've been doing with Dr. Adam Freed, and we're out of Midwestern University in Glendale, Arizona. And so the study that I'm talking about is looking at perceptions of discrimination and inequality in healthcare services within the BDSM community. So a little bit of preaching to the choir here, but we know that stigmatized groups have higher levels of medical mistrust and are at increased risk of experiencing discrimination when seeking healthcare services. And that because of this mistrust and because of these experiences with discrimination, we have these missed opportunities for prevention and intervention because people will avoid healthcare services. And so looking within the BDSM community, there may be a reluctance to share injuries or ask specific questions because of identification with the Kink community or the BDSM specifically. So our study was looking at the perceptions of and experiences with stigma and discrimination in the healthcare system. So we recruited a sample exclusively online. About half of our sample came from FetLife. We also recruited through the NCSF newsletter. Thank you, Susan, Wright, for that, and Instagram and Reddit. Our inclusion criteria were that you had to be over the age of 18 and had to have engaged in BDSM with at least one other person. And we opened it up to both in-person and online play, though the vast majority of our sample played exclusively or primarily in person. So we ended up with about 288 participants, and the average age was 39, and this was a considerable range, 18 to 78. We also noted that where our participants came from seemed to impact age and other demographics. So, for example, FetLife at NCSF, the average age was 43, but then when we looked at those who came to us via Reddit or Instagram, that was a little bit lower with 32 and 33 years old. And that in general, our sample had a long-term experience with BDSM. So 44% of folks indicated that they had been engaged in BDSM activities for more than 10 years. And then we had a very white group with a slightly larger percentage of male participants, and the most common orientation was heterosexual. And about half identified as submissive. So what we were looking at were measures that we adapted from Fisher et al. And so Fisher et al. Was looking at discrimination and equity within the LGBTQ community. So we adapted 3 of the scales that they utilized for the Kink community. And so we first looked at the medical mistrust scale, which looked at reluctance to discuss sexual health needs due to concerns about provider criticism of sexual behaviors. We also looked at medical discrimination, so specific discrimination experiences by the individual within the healthcare system, defined broadly: negative comments, criticism, disapproval, or inadequate or poor treatment. And then the health equity scale, and this generally looked at beliefs about equity and discrimination in healthcare settings. And so what we found, we were happy to see, most participants had a primary care provider. Midwestern University is primarily a medical school, so we're always glad to see people are getting healthcare services. And about a third of participants reported that they hid injuries from their primary care provider, injuries as a result of BDSM play, and that this was more likely in those individuals who identified as submissive. And about 1 in 5 of our participants reported that there were injuries that they would have liked to discuss with their primary care provider, but they didn't. And interestingly, there was no difference in BDSM role or gender in those who indicated that there were these kind of missed opportunities, these injuries or experiences that they would have liked to talk about, but do not. And so looking more specifically at these constructs, almost half of our participants indicated that they avoided asking questions about their sexual health because they didn't want their provider to know about their membership in the kink community. Almost 60% said that they didn't discuss sexual issues because they worried about the provider's acceptance of their membership in the kink community. About half did not ask questions about safer sex practices because of worries about this reaction. And very concerningly, almost a quarter avoided STD or HIV testing because of worries that they'd be outed for their participation in kink. Looking at specific discrimination experiences, about a quarter of our participants indicated that a healthcare provider or staff member criticized them for being kinky. About a third felt discriminated against by a healthcare provider or staff member. 22% indicated that they had poor medical treatment because of their identification with the kink community. And 28% said that a healthcare provider or staff member made negative comments about people in the kink community. And again, about a quarter indicated that they did not receive the sexual health information they needed because a healthcare provider disapproved of their participation in kink or BDSM. And then looking at equity, and then not surprisingly, these numbers were quite low. A very small percentage, 16% of our participant sample believed that members of the kink community received the same medical care from doctors and healthcare workers as people from other groups. 14% thought that the kink community was treated the same as other groups by doctors and healthcare workers. 18% thought that people with different sexual identities would receive the same care in hospitals. About 15% thought that doctors had the best interest of members of the kink community in mind. So we're seeing relatively high levels of mistrust, concerning rates of discrimination, and low levels of belief of equity in the healthcare system. When we looked at these data a little bit more closely, what we found is that those who endorsed higher levels of medical mistrust and higher rates of discrimination were less likely to discuss their BDSM-related concerns with their healthcare providers, which makes sense. And that participants who believed that members of the kink community did not receive the same healthcare were less likely to talk to their primary care provider about BDSM-related health concerns, which can make sense. And so we wanted to look a little bit more closely at what was kind of driving this bus, or what's driving some of these decisions about disclosing or not disclosing to healthcare providers. And so we did a linear regression, and we looked at what was the likelihood of hiding a BDSM-related injury from their primary care provider. And so we looked at length of time in the BDSM community, beliefs about health equity for the kink community, experiences with discrimination, medical mistrust, and frequency of BDSM play. And what we found is that it was only medical mistrust and then frequency of BDSM play that predicted whether or not individuals were hiding BDSM-related injuries from their healthcare providers, which makes sense. If you're mistrustful, and then of course, the more that you play, then in theory, you may have more injuries to hide. So we know that patient disclosure of relevant history, particularly sexual history and information, is key for effective treatment and care in medical settings. And that sexuality in general is under-discussed in primary care, and that there are things that providers can do to improve the disclosure of sexual health information in general, and that common predictors or ways to encourage this conversation is to demonstrate that you're actually listening, and if the patient trusts the provider. And so similar to previous research on sexual health in primary care, participants indicated, or at least a decent percentage of the participants indicated, that there are topics about their sexuality and their BDSM at play that they would have liked to discuss with their healthcare provider. However, similar to other stigmatized groups like the LGBTQ community, BDSM practitioners had a high level of healthcare mistrust and avoided discussing kink-related health issues because of this mistrust and fear that providers would react negatively, which is somewhat justified by the discrimination experiences that were reported. That most participants didn't think that BDSM practitioners were receiving the same level of healthcare as other communities. So what we're looking to move forward is looking at what we can help providers do, which actions and characteristics can improve rates of disclosure. And because we know that mistrust seems to be one of the driving factors in hiding injuries, we want to, and we know that there is a desire for more information from healthcare providers, that we need to continue to work to build trust within the BDSM and other marginalized communities to encourage these conversations and to ensure that we're able to provide effective healthcare services. And there are gazillion resources or references for this research project, but here's just a couple that were particularly relevant. And that is my research. And I'm going to stop sharing my screen.
Good job. 10 minutes on the dot. Does anyone have any questions for Kate?
Kate, do you think that your findings would also generalize to mental health providers?
Yeah, it's a great question. And spoiler, we did ask a second round of the surveys about mental health providers, and mental health fared a little bit worse. There was actually a little bit less disclosure and more experiences of discrimination. And so there's definitely work to be done in both mental and physical health, but so pretty similar results.
So there are two questions in the chat. The first is, how did your team define the word doctor?
Good question. So we kept it pretty broad. So within the survey, we said healthcare provider, and then in parentheses, physicians, nurse practitioners, and we were providing physical health care. And we were pretty careful about that because the second survey was specifically about mental health care providers, that we wanted to be sure that participants were specifically thinking about physical health care.
And we have one more question in the chat, and then Sarah has their hand raised. So question in the chat, are you going to post your contact information, such as email or website?
Yes, and we'll put it in the chat right now.
Sarah, did you want to ask your question?
I did, thank you. I guess I'm curious, when I think of where we are with kink and healthcare providers today, I think it reminds me of where we were, 20, 30 years ago with LGBT or LGB issues. Let me go a little bit more general. What do you think are the biggest barriers for healthcare providers in addressing their own biases related to individuals who are practitioners in kink and BDSM? And how do you see educators and others working to address those biases, and what do we do? How do we do this?
Yeah, it's such a good question. And one of my favorite parts of my job at Midwestern is getting to give lectures to med students and residents. And it's consistently surprising to me how little education they get on sexuality in general. And then to take things a step further to LGBT health, and then a step further into kink and BDSM, there's a long way to go. And so I think emphasizing the importance of sexuality education in general, getting people used to talking about it at all, and then from there kind of building into areas of expertise, like making sure that every time we have these sexuality 101 lectures, that we're touching on all of these groups, so it just becomes a normal part of the education. But there are so many opportunities, and it's so rare that I get resistance to talking about sexuality and sexual health, and more just that there needs to be more time, there needs to be more dedication to this topic, particularly for primary care providers, who are the kind of first line treatment for a lot of these folks.
Thank you.
And Sue, would you like to ask a question? And this will be the last question potentially before we go on to the next.
Thanks, Frederick. Thanks, Kate. I'm just wondering, so speaking of the lack of competencies, lack of cultural competencies among the professionals, how do you see it's related to the education system? So for example, if we're talking about mental health professionals, and because you're talking about like this discrimination is even worse, how does that relate to education system, clinical model, things like that? Thanks.
Yeah. So I mean, I think we can go really broad here and looking at least within the United States, starting with sex education in elementary and high schools and the differing levels of information and types of information that just the general public is getting before they go out into the world. And then speaking more to professionals, you know, I'm a psychologist, and so I'm from psychology training. I work in a medical school, and just the breadth of information that is expected for folks to know is really overwhelming. And I do want to acknowledge that people know a lot about a lot in these fields, but that really the way that changes are made are at the kind of accreditation level, that these are required competencies, and that this ability to speak on these topics and to treat patients with different issues needs to be measured in a meaningful way for it to be meaningfully taught. Does that answer your question?
Yes, thank you.
Okay, thank you.
Thank you so very much, Kate. I really appreciate you sharing everything that you just did today. And